We begin this hour with breaking news out of Ontario, where the province is posting another daily record of COVID-19 cases. Ontario adding today 1,575. That's a jump from the over 1,400 posted yesterday. Of those, 9.7%, so almost 10%, come from the Peel region, 5.8%, just about 6%, Toronto. The province will be releasing its latest modeling projections later this afternoon. We'll bring that to you live. In the meantime, I want to bring in CTV News infectious disease specialist Dr. Abdu Sharkawy. He's in Toronto. Dr. Sharkawy, 1,575 new cases today in Toronto, just hours before we're going to be getting a projection as to what it could look like in the coming weeks. What's your reaction to another day of record-breaking cases?
Yeah, this is a very disappointing trend that we are witnessing right now. And unfortunately, it's something that many of us had predicted happening. And we are on track for 2,000 cases per day, which is a truly alarming figure to try and wrap our heads around. It's quite clear at this point in time that the existing level of restrictions, wherever they are, the nuanced pattern that has been applied, is a failure. There is no way around it. We are seeing the healthcare system being constrained. We're seeing firsthand events of hospitals requiring significant help and relief from other hospitals across the GTA. This is a situation that is very worrisome. And I think if we have any hope of trying to look forward to a holiday season where we have anything to celebrate, never mind if we're doing it with our nuclear families or otherwise, we've got to impose some new restrictions and make some firm decisions right now for the safety of everyone.
But where, Dr. Sharkawy, where do you make those restrictions? Where do you see as the holes in this plan?
Well, I think we have to do whatever is possible to restrict any form of private gatherings. We have to consider the possibility of circuit breakers where we ask people to stay at home, frankly, for anything that is non-essential. I think we're looking at the possibility of shutting down non-essential businesses for a period of time to try and get this under control. The situation as it is right now is completely untenable. And all we have to do is look to see what's happening in Europe. Look at what's happening now in southern Italy, where people are dying in hallways and oxygen is being administered to patients in the parking lot, never mind in waiting rooms. I mean, that is just a staggering and very, very sobering thought. And if we think that that's something we can avoid in Canada, simply by going along with what we're doing right now, we're fooling ourselves. I think it's time to be absolutely serious about this, and I hope we can get the support of our policymakers to ensure that we do what's right.
How did we get here? Late August, early September, we were looking at numbers in Ontario of less than 100 cases per day.
I think there's a lot of reasons why we got here. We have to remind ourselves that the circumstances that we're operating in the first wave are very, very different from what's going on now. In the first wave, I think there was a lot of just crippling fear, frankly, and a lot of uncertainty amongst the public at large. And I think that by and large, public health messaging was adhered to. People stayed in their homes. Businesses were closed that were non-essential. Schools were closed as well. And I think you had a level of compliance in the community that helped us get this under control. The problem is that when we opened up, I think we opened up with an unrealistic expectation that things would remain that way. Particularly in the younger demographic, we had people that started to socialize a lot more frequently than perhaps they had done in the spring. And we have to realize that without a vaccine, without an effective therapy, especially without optimal testing and contact tracing ability, we were going to see numbers skyrocket. And that's exactly what's happening right now. We really don't have much on our side right now to control this pandemic except our own behavior and our ability to stay out of communal settings and any sort of close proximity to one another. And the measures that are in place right now are simply not conducive enough to helping that occur.
Are you advocating a full lockdown like we had in March and April?
I think that's unavoidable. And I know that that's an unpopular notion to consider. I know that it conjures up a lot of negative thoughts for people. And believe me, I empathize with all of the serious distress that many people have incurred through the collateral damage of what a lockdown brings. But it's becoming abundantly clear on a daily basis that this is a situation that is raging out of control. We have the possibility of seeing record numbers of deaths in long-term care in other parts of our community that far exceed what we saw in the first wave. And allowing that to happen is unacceptable. That's not an option that we have at our disposal right now. We've got to make this difficult decision, and time is of the essence.
I hear you on every point, but I do hear also from people who say there is a really, really high price to pay for a total lockdown. And you mentioned the mental health component, not being able to pay your mortgage or your rent or worrying if you're going to be able to put food on the table or do both of those things. So it's just, I don't know, doctor. I mean, what do you say to those people who say to people who are salaried workers that, it's easy for you to say, but our lives are depending on something else. We can't do another lockdown. We just can't.
I completely understand. And I'm very sympathetic to a lot of people who clearly are much less privileged than I am and who have very little means and frankly had a very lousy quality of life even before the pandemic. And that's only gotten worse. And lockdowns don't help that. Unfortunately, there's very little in the way of other options at this point in time to help get the situation under control. And if we're looking at the economic reality here, the economic fallout from not being able to control this pandemic far, far outweighs the economic fallout that will happen from a measured lockdown. I think it's time for our government to look deep down and do some soul searching and decide whether it's time to start giving grants and to provide some tangible financial relief to small business owners and others who are disproportionately going to be burdened and affected by this situation. It's not fair for small business owners to bear the brunt of what's going on here because people are gathering irresponsibly in their own homes and celebrating things that they shouldn't. But there's very little choice when the situation has gotten out of hand the way this has at this point in time. So we need our policymakers to show the support that they have determined is needed for entrepreneurs, for our business community, for others who have been disproportionately affected by this, so we can keep them in a healthier place while we try and keep the rest of the community healthy as well.
Dr. Sharkawy, thank you so much. We got to keep it real. I appreciate your time with us this morning. We'll see you again really soon.